Aloha, and thank you for joining us today. My name is Dr. Catherine Taketa-Wong. I'm a naturopathic physician and acupuncturist. So for those of you who aren't familiar with naturopathic physicians, like medical doctors, we have to attend a four-year medical school. We're trained as primary care physicians, and as such, I can order lab tests and write prescriptions and do school physicals just like other doctors. However, a big difference is that naturopathic doctors are trained in the power of nutrition to build health from the inside. I use personalized food recommendations, as well as vitamins, herbs, and other types of natural medicines to address the underlying causes of disease and treat the whole person. I also have a master's degree in Oriental medicine, which allows me to include Chinese medicine and acupuncture in my treatment protocols. Before we begin, I wanted to let you know that if you have health concerns you'd like to talk with me about, we offer a no-charge phone consultation called the Personal Health Strategy Session. This is a 15-minute strategy session where we can talk about your condition and come up with a plan to see how I can help you the most. Arranging a consultation is very easy. Just call our office at 808-425-2987 and let our staff know that you're interested in a no-charge phone consultation. Okay, let's get started, and please feel free to use the comment section to ask questions as the talk progresses. Today, I want to talk to you about smoothies, and it may seem like a very simple kind of topic, but there's a lot to this actually, much more than people realize. Smoothies have a healthy reputation, but the question is, should they? Most people know about the supposed benefits. They can combine different fruits and vegetables into an easy to swallow drink. They can be tastier than just individual pieces of fruits or vegetables. They can also be consumed quickly if you're on the go, whereas the fruits or vegetables themselves take more time to eat. Greens can be drunk instead of eaten, which saves cooking time. And there are other benefits where some people will use them to get vitamins into kids, or they will try to use it as a way to try to get greens or nutrients into people, into kids who are really picky eaters, or other people who are trying to gain weight. So those are the benefits that we've learned about, but what about the downside of smoothies? Are there any? And of course, there is one big problem that I'll be telling you about soon. One of the things that I want to bring up is that green smoothies definitely have a reputation of being a health food. There's a lot of different health magazines that will give recipes for green smoothies where you can put greens like spinach and kale and baby chard and other kinds of things into your smoothies as a way to get your greens in. And they'll also often have recipes that basically provide a way that you can get those greens in, and it's healthy and it's promoted as something that is very healthy. And definitely getting a lot of greens in certainly is healthy and certainly can be very important. One of the things that I want to point out, however, is that whenever people are either doing smoothies or if they're juicing, we can drink quite a lot more than we can usually eat in a whole food form. And a lot of these green smoothies that are talked about are foods that tend to be very high in oxalates. So oxalates, most people have never heard of them. What are oxalates? Oxalates are a compound that are naturally present in foods. And oxalates are something that most people usually don't have difficulty digesting or breaking down. However, there are some people that may have difficulty being able to break down oxalates. And if oxalates build up in the body, or if they're consumed in very high amounts, then they can be one risk factor for calcium oxalate kidney stones, which is the most common type of kidney stone. And one of the things that I've usually seen these issues only in people who are drinking high oxalate, either smoothies or juices every single day, or on a very regular basis or in large amounts. But some of the foods that are in green smoothies, for example, like spinach or beet greens or beets, blueberries, almond milk, chocolate, all of these things are very high oxalate foods. And so if someone is consuming a very high oxalate content smoothie every single day, that can be a risk factor for developing calcium oxalate kidney stones. So it's one thing that I point out to people, that if they are doing smoothies, that they need to really be careful about the things that they're putting into their smoothies. And particularly if they have had a history of calcium oxalate kidney stones, then I will usually caution to not do any high oxalate smoothies or high oxalate juicing. So some of the things that you can find, you can look up oxalate content in foods, and there are different kinds of food lists that you can find online, where you can find things that tend to be very high oxalate and then things that are low oxalate. So as I mentioned, things like very high oxalate foods are almonds, beets, and beet. So beets themselves, the beetroot, as well as beet greens, chocolate, and then other kinds of nuts, spinach, Swiss chard are very high oxalate foods. And so with someone who has a history of calcium oxalate kidney stones, they really should try to avoid those types of really high oxalate foods. Some other foods that are commonly put into smoothies that are high oxalate are things like cashews, peanuts or nut butters, like pecans. Some people may also put other types of greens, like collard greens, into their smoothies. So those are some other high oxalate foods, and some other high oxalate fruits. Those can include things like blueberries and some of the other things that we look at. Let me see. So some of the high oxalate, some of the other foods, some people, like I said, they'll put blackberries or raspberries or blueberries. Those are common, berries are very commonly put into smoothies. Also kiwis are very high in oxalates. Grapes are high in oxalates. So these are things to just be aware of. And so what's the remedy? I tell people, well, you can always do smoothies that contain low oxalate foods. And so some low oxalate things that you might put into smoothies, for example, could be things like apples, avocados, cherries, coconut, or if you're using a liquid, instead of using almond milk, which is very high in oxalates, you can use coconut milk, which is low in oxalates. Also grapefruits or grapefruit juices, mangoes, lychee, melons, nectarines, oranges, papaya, peaches, and pineapple are all fruits that are low in oxalates. And in terms of some of the greens, most of the greens that people typically think of putting in smoothies, like I mentioned, like the spinach is very high in oxalate. Kale tends to be moderately high in oxalates, and also beet greens and chard. Sometimes people use mixed greens with baby chard, and those do tend to be high in oxalates. So some low oxalate vegetables that could be used. So avocado technically is a fruit, but some people would consider that to be a vegetable, where you can put that into smoothies that is low oxalate. And also cabbage is low oxalate. Also lettuce and green peas, watercress, which doesn't sound too appealing, but if you put it in small amounts, then that is something that could be helpful. Also broccoli, Brussels sprouts, and cauliflower are all low in oxalates. So, and then also cucumber and fennel are also low in oxalates. So those are some low oxalate foods that you can put into your smoothies, that if you are doing smoothies, I usually tell people, even if they don't have a history of kidney stones, it's usually better to do a combination of low oxalate and high oxalate foods, just making sure that you don't have high oxalate foods every single day in your smoothie, because that's usually where I've seen people run into problems. And I have had a few patients that have had kidney stones that didn't have any other risk factors. They had no family history, they were drinking lots of water, eating a healthy diet, but that they did have their patients who were either juicing or drinking smoothies every day that were usually the same smoothie every day, like with beets or beet greens, spinach, blueberries, almond milk, chocolate, etc. So anything of I think anything in excess is not going to be good. So I tell people, vary it up, change your smoothies, don't do the same one every day, and make sure that you are getting a combination of low oxalate and high oxalate foods in your smoothie. Or if you do have a history of kidney stones, then probably just doing more of the low oxalate foods in your smoothies. So that's problem number one, is the oxalate issue. Problem number two, there are a lot of actually issues in terms of having fruit smoothies, which are considered to be healthy, but they can contain a fairly high sugar content. And most people don't really realize that if they are doing a lot of fruits, and if they're especially adding fruit juices into their smoothie, sweetened almond milk or sweetened coconut milk, you can really increase the sugar content pretty significantly in your smoothie. Now, this can be helpful for people who are trying to gain weight, or children, or patients who are underweight. For example, patients who are going through chemotherapy, patients who may have difficulty swallowing, and so they can only do soft foods or foods that they can easily swallow. Patients who have very severe esophagitis, or basically acid reflux, where they have a lot of inflammation in their throat, where they have difficulty swallowing. Having a high sugar content may be helpful, especially if people are trying to gain weight. However, a lot of people in America do tend to be overweight, and a lot of people are trying to lose weight, and so they look to smoothies as a way to lose weight. And it can be, but you do have to be careful about the kinds of things that you put into your smoothie, because you may unknowingly really rack up the sugar content in your smoothies. And as I mentioned, that people can drink a lot more than they can typically just consume as a whole food. And so what can happen with that is that people unknowingly may be consuming a very high amount of sugars or carbohydrates in their smoothie when they are trying to lose weight or decrease their carbohydrate count, and not realize that they're actually consuming a pretty high amount of sugars in their smoothies. And I particularly caution people with things like bananas. Bananas can be helpful to sweeten up a smoothie if you're doing a lot of greens or other vegetables or things that are not sweet, or are using unsweetened milks. But if you're doing a lot of bananas in addition to fruit juice, and adding some sweetened yogurt, and then adding other types of fruits, then you can have a pretty significant sugar and carbohydrate load in a smoothie. So in those cases, I usually will encourage people to try to make sure they're using unsweetened milks and using more greens, and just trying to eat the foods in their whole food form. Because one of the things that a smoothie does is that, either smoothies or juicing, is that juicing takes out the fiber entirely, because it's only the juice that's present in that food, and you don't have the fiber. And smoothies, you will have some fiber. However, when you put it into a magic bullet or a blender, what that's doing is breaking down a lot of the fiber. And fiber is actually really important to help to balance out the sugars. So any patients, if you're doing a ketogenic diet or really watching your carbohydrate count, often they will talk about that the amount of fiber in the food will offset the amount of sugars, and that if you're doing a carb count, that they don't count the fibers that is in there as part of the carbohydrates. They will actually minus those out from your carbohydrate count, because fiber will help to slow the release of the sugar into your blood, and it'll help your blood sugar to go up more gradually and then come down more gradually. So if you're doing a smoothie that has, for example, sweetened milks or juice, it has banana and blueberries and sweetened yogurt, then as I mentioned, you can be getting something that has a fairly high sugar content without a high amount of fiber. And what that can do is it can make your blood sugar spike and then crash. And when people are in this crash, that's typically when they will get sugar cravings. Whereas if you have a higher amount of fiber in the food, even if you're eating the exact same foods, but they're not blended up, then you'll have a higher amount of fiber, and it's not as broken down as it would be if you put it into a blender. And so what happens is you'll get a more gradual rise in your blood sugar, where instead of the blood sugar spiking and then crashing, what will happen is that you'll get a more gradual release of the blood sugar. Your blood sugar will go up more gradually, and then it can come down more gradually. And that's helpful because when people, particularly people who have diabetes or pre-diabetes, the problem is your body's ability to regulate your blood sugar, to keep your blood sugar within a safe level, because you don't want your blood sugar to be too high or too low. So what can happen is that when you're eating foods that spike your blood sugar and then they crash, it's causing this kind of yo-yo effect, because your blood sugar will spike and then it'll crash and you'll crave sugar at the crashes, and then you eat sugary food and then it crashes again, and then you get into this yo-yo type of effect. Whereas if you can eat foods with high amounts of fiber, and particularly high amounts of protein and good fats. So protein, I'm thinking of nuts, seeds, also legumes, like, for example, beans or lentils, and then also lean meats, fish, and in terms of good fats, that also includes avocado or olive oil, coconut milk, some of these foods that have a high amount of fat that can help to, so basically fiber, protein, and fats, what they do is they help to slow the release of blood sugar into your blood, or slow the release of sugar into your blood, so that again your blood sugar goes up more gradually and then it goes down more gradually. And then your blood sugar is better able to stay within the safe zone and not go too high or too low. So that is really important for diabetics. So make sure that if you do have diabetes or pre-diabetes, that you're checking on the sugar content if you are doing smoothies, and really trying to make sure that you're not getting a very high amount of simple carbohydrates. Again, just to let you know, we'll be wrapping up soon, and I just want to remind you that we offer a no-charge phone consultation. If you want to talk with me personally about any health concerns that you have, arranging a consultation is very easy. Just call our office at 808-425-2987 and let our staff know that you're interested in a no-charge phone consultation. One third big problem that I want to mention with smoothies is that nature has really designed our bodies to eat food in their whole food form. So food has to be chewed. Chewing triggers saliva, and saliva is essential to mix with our food in order to start the process of digestion and extract the nutrients. So did you know that up to 30% of digestion occurs in the mouth? Our saliva has digestive enzymes in it that breaks down the food, that starts that process of digestion. You wouldn't swallow an apple first without chewing it, and you certainly wouldn't swallow spinach without chewing it first. But when we drink our food, what we're doing with smoothies is that we're setting ourselves up to potentially stress our digestive system, lose nutrients, and if you're doing high oxalate foods all the time in your smoothies, then potentially get kidney stones. So smoothies can be tasty, but we should never let taste fool us, and we should never let taste rule us. The guiding principle should be, is it good for my body? Then we consider taste and other things. So that is the one big problem with all smoothies, is that they are typically swallowed instead of chewed. The solution is easy. Chew your smoothie. It may sound strange, and to think of chewing something that is the consistency of a smoothie, but the way it works is that you take small sips and basically just swish it around in your mouth to mix it with your saliva. And that way the digestive process, which starts in the mouth, retains its integrity. Also, just the act of chewing itself will stimulate our body to produce saliva, and will stimulate our body to start producing digestive enzymes in the stomach and further on in the digestive tract. So just the act of chewing, even if you're not really mechanically chewing the food, but just the act of chewing itself, like moving your mouth, can actually stimulate the digestive enzymes further along your stomach. So chewing your smoothie is basically the answer to that. Now, who needs smoothies? What kind of things are these what kind of conditions are these helpful for? As I mentioned, there are certainly patients that I do recommend smoothies for as one type of dietary intervention. And they can be very helpful, and they do have their place. So I do recommend them for children with autism who are extremely picky, who won't eat vegetables any other way, or even children without autism who are extremely picky and they won't eat any vegetables or fruits in their whole food form. There are some children who have problems with certain textures, and sometimes it can be easier to get a smoothie into them than getting them to actually eat the fruit or the vegetable in the whole food form. And also because smoothies tend to taste pretty good, you can make them taste good. They certainly are a way to get vegetables into children or adults who are extremely picky and won't eat vegetables otherwise. I just recommend that people follow those guidelines in terms of trying to find low oxalate foods and mixing it up and not doing the same smoothie every day, making sure that you do have low oxalate foods in the smoothie, and then also that you try to chew your smoothie or mix it up around your mouth. For children, I know that may be hard to try to get them to do, but you can just encourage them as much as you can to do something like that. Also, cancer patients who have trouble keeping their meals down due to chemotherapy or significant nausea or other types of things. There, of course, are herbs and a number of other things that I use to help with nausea that typically comes along with chemotherapy and the diarrhea, and I usually have good success with that. But certainly cancer patients or people who are extremely underweight, who have difficulty being able to gain weight, people who, like I mentioned, have difficulty swallowing, particularly if there is pain in their esophagus or their throat, where they have trouble chewing or swallowing. Anytime we're trying to get people to gain weight, then these are the instances where you may want to do a smoothie that is very high in calories, in sugar, in protein, and in fat, as a way to be able to get more calories into them, because, as I mentioned, people can typically drink more than they can eat. So that may be very helpful for patients who are very underweight and we're really trying to get them to gain weight. So it can certainly be helpful for that. And as I mentioned, people who have difficulty with swallowing, some people may experience quite a bit of pain, especially if there's a lot of inflammation in their throat. They may experience a lot of pain when they're swallowing whole foods, and that makes eating very difficult, but they may be able to swallow something that is soft, like a soft food or like a smoothie, because it is liquid or liquidy, and it's easier to swallow, and particularly if there's a lot of pain with swallowing, then that is much easier to get down rather than a food that's in its whole food form. So those are primarily the groups that I will recommend smoothies for. I will also sometimes recommend smoothies for patients who are extremely constipated. And I find that doing smoothies, getting a lot of fruit and vegetables, can definitely help to loosen up the stool. So patients who are experiencing severe constipation, where either they are not pooping every day or their stools are very hard or painful to pass, then smoothies can be a quick way to get the digestive system going, get a lot of fruits and vegetables into them. And also it can be a vehicle for getting in some types of foods that can be laxative. So for example, if someone is going through constipation, full fat coconut milk, so the type of coconut milk that you get either in a can or a Tetra Pak, like a juice box type, the coconut cream has a natural laxative effect. And so you can easily put some coconut cream, a few tablespoons, into a smoothie. You can also use things like chia seeds or flax seeds, which are good sources of fiber. You can add that into your smoothie, and that will help to, that fiber helps to increase the frequency of how often you have bowel movement. So those can be helpful, and a lot of people may not eat or consume some of those things like coconut cream or chia or flax seeds and other foods, but they will consume it in a smoothie. So that is a vehicle that I use to help people with constipation. I usually will try to encourage them to eat more fruits and vegetables besides just doing smoothies. But if that's difficult, then smoothies can be a good vehicle for that. And I also use smoothies as a vehicle for getting supplements or medications into people who, especially children, who are very picky, and it's very difficult to get medications or vitamins or herbs that don't taste very good. It can be helpful as a way to get into them. So there are some children who won't take a lot of vitamins or other kinds of supplements, and so we'll have the parents put it into a smoothie, and if the child won't drink a smoothie, then I'll often have parents try, if the child likes popsicles, try putting the vitamins into a smoothie and then freezing it into a popsicle, or I'm getting a homemade popsicle maker, and then using that as a way to be able to get vitamins or nutrients into them. And most vitamins or nutrients can be frozen. Most of them cannot be heated or cooked. But most of them can be frozen. And so that can be a vehicle to get vitamins or medicines into people that have a really difficult time taking vitamins or medicines otherwise. And as long as individuals take small sips and chew gently or slowly, for the most part, these types of individuals can definitely benefit from smoothies. So I want to thank you again for being here, and I appreciate the opportunity to let you know about the pros and cons about smoothies and what you can do if you have a smoothie to gain the nutritional benefits and avoid the pitfalls. If you would like to talk with me about any concerns that you have, again, you can call our office to arrange a personal health strategy session. This is our no-charge phone consultation for people interested in talking with me about a medical condition. Just call our office at 808-425-2987, and you'll also find the contact information on our Facebook page. Also, just a reminder that we have our programs, they're business wellness programs, where I talk about different ways that can help employers and employees to be able to decrease sickness, improve productivity, be able to increase attention and focus, to lose weight, decrease absenteeism in the workplace. And so we're doing workshops, series of presentations, different kinds of things. So these wellness programs are specifically targeted for businesses. So if you are an employee or an employer, you can feel free to call our office as well to ask more about our business wellness programs and see how that could help your business or your company. So again, the number for that is 808-425-2987. Mahalo, and we will see you in 2 weeks. Aloha.